In today's video, I want to discuss a condition called spinal stenosis. Hi, I'm Dr. Todd Sullivan from Nova Chiropractic and Acupuncture. One of the most common conditions I treat in my office is called spinal stenosis. So spinal stenosis is the narrowing of the space where the nerves exit out through your spine. This can occur either in your neck or in your lower back. Most common is probably the lower back, around L4, L5, or L5S1, which is right above the belt line in your low back. So what happens with spinal stenosis is the space where the nerves exit out through your spine, they narrow. So if normally they're this big, when with spinal stenosis, they can be reduced down. And what happens with that is it irritates the nerves that exit out through the spine and then can cause lower back pain or pain that radiates down your legs. So with spinal stenosis, the narrowing is caused by arthritis. It can also be caused by like a disc bulge or something else kind of pressing into that space, but a lot of times it's that arthritis that will develop over time and then that narrows that space where the nerves exit out. Now with spinal stenosis, the reason sitting relieves a lot of the discomfort for the patient is when we sit, it can open up that space where the nerves exit out. Now again, it's not removing that arthritis in there, so when they get up and start walking again, it's going to irritate the nerves again. That's why sitting will temporarily relieve a lot of the symptoms for these kind of cases. And what I want to do is I want to talk about a common treatment we do in our office to relieve the pain and discomfort from spinal stenosis. One treatment we do for spinal stenosis is called flexion distraction. So flexion distraction uses a special table that flexes down from the waist down and it opens up that space where the nerves exit out. And that increases that foramen or that space where the nerve travels and it relieves a lot of the pain and pressure on that low back. This can accelerate the healing by twice as much. And so we get patients on this table, we're doing the treatment, we add in the laser therapy, it gets patients out of pain immediately and allows them to function and to move around a lot easier without discomfort. The combination of the flexion distraction table and the laser therapy is a highly effective technique at relieving the pain and discomfort in that area. And a lot of times we're able to get patients to a point where we can get them feeling really good and they can function on their day-to-day lives. And then at some point, because we're not removing the arthritis, that irritation and the inflammation to the nerves may come back. But I have several cases where I may see them once or twice a year, or we have some cases that have to come in like once a month to keep the area under control and to take the pressure off. I highly recommend you find a practitioner that uses flexion distraction for spinal stenosis. So what we're going to do is we're going to demonstrate what the table looks like and how it functions, and then I'm going to demonstrate an actual treatment on a patient and what that's going to look like. The most effective way to treat spinal stenosis is with a table like this. This is called the flexion distraction table. And what it does is this section of the table will flex down, and what happens at the spinal level is it opens up that space where the nerve exits. So again, with spinal stenosis, it's a narrowing of the space where the nerves exit out. And this is just one way to open up that space and to help loosen up those tight muscles in your low back. So what I want to do, I want to demonstrate what it looks like, and then I'll do a patient treatment so you can see what that was going to look like as well. So when we're doing flexion distraction, you can see the table is flexing down, and this is a motorized one. So what's nice about it is I can do treatment on your low back, and then while this is flexing, you're going to get the flexion and decompression of the low back there. So this is a nice, comfortable flexion. I can increase the speed or decrease it. Sometimes we'll also put patients on heat and stim while we're doing this, and that's another way to relax the low back and take the pressure off there. So this table can also shift left and right. So if, for example, a patient has an issue more on their right side, while it's flexing, I can open up that space on the right side to take the pressure off the nerve. So how that works is I have this handlebar here, and so we're gonna go to the left in this situation if I'm treating someone's issue on the right side, or I can go to the left, and we can get really good range of motion, and it can stretch out those muscles on that side of the spine that are really tight. Another nice feature of this table for people suffering from spinal stenosis is it can be used to do what we call a drop technique. So a lot of times with spinal stenosis, those patients are really rigid and they can't tolerate a regular chiropractic adjustment. Well, this drop table is one way you can get the joints to loosen up without having to put you in a side position there. So what that's going to look like is this table will pop up, And then basically we're going to press on the spine and then the table drops down. And what that does is it uses the drops to accelerate the adjustment for the low back there. It's a very comfortable way to adjust the low back and take the pressure off if you're dealing with spinal stenosis. So now I'm going to demonstrate what a typical spinal stenosis treatment looks like using a flexion distraction table. When we're treating a patient with spinal stenosis, we're trying to open up this portion of their lower back. And so again, it's right around the belt line typically where that stenosis will occur. And so what we're going to do is we're going to concentrate the stretch right there. And I'm going to use my other hand here and we're going to apply a little pressure in her low back. And that feels very comfortable. Again, it feels like a really good stretch for the low back there. And we can do this for several minutes, again, to open up that space and to help calm things down. And sometimes, depending on how tight a patient is, sometimes we'll use 2 hands and get even a better stretch. And I can work my way up her spine to try to release certain areas throughout the low back here. So again, what it's going to look like if we're treating the upper portion, and just get a nice stretch and relaxation. Now what we can also do, like I said, is we can open up one side specifically. So if I was treating her right side, what we would do is we could flex the table and then go to the left. So I'm going to bring the table down, stretch more that right side, and I can even keep that in that position and then apply a little bit more stretch on the right side. And again, this will relax those tight muscles on the right side. Sometimes, obviously, if it's the opposite side, we can do the same thing here and stretch the left side. But this is a great way to kind of isolate if it's affecting more of one side of the low back there. So Renee, how would you describe what this feels like for your low back?
The motion of the table actually is pretty soothing itself. And then you can feel a stretch, and then when you use your hands, the stretch does feel much deeper. But it's comfortable and it feels like a better stretch than I would be able to achieve on my own.
So yeah, when you're dealing with spinal stenosis, again, if you're upright and walking around, a lot of times what will happen, everything will be very compressed and very tight, and you'll get pain that's either just in your low back or radiating down your legs. And so when you're dealing with pain, if you sit down in a chair, it'll relieve that discomfort. Well, this is a way to really open up that space where the nerves exit out through the low back and take the pressure off that. It's like almost like magnifies that feeling of when you're sitting in that chair and relieving that pain. This even takes it to the next level. And it's a very safe treatment to do. So if you have arthritis in your low back, it's a very gentle motion, but it's a great way to stretch out that low back and relieve that pain. One nice feature of this table, it is automated. So what that allows me to do, if someone's dealing with a really painful spinal stenosis case, I can also apply laser therapy over the affected region and get 2 treatments in one. So the laser therapy is a powerful way to reduce any pain and inflammation. And then we add it in with the flexion distraction table, and it really takes all that pressure off the low back while reducing any inflammation to the nerves. So what that's going to look like while we're doing the treatment here is we're just going to apply the laser treatment right over her low back. And again, typically it's right above the belt line where all the pain and discomfort is. And so we're going to apply it right in that area. And I can trace up and down the spine depending on where the issue is and work that whole region there. A typical treatment in my office using the flexion distraction table and with or without the laser therapy is about 10 to 15 minutes. And then we will do additional treatments as needed depending on where the problem is. One way to adjust patients with spinal stenosis is to do a drop table technique. So what that's going to look like is we have the table set up where underneath the low back, the drops are going to pop up, and then I'm going to apply pressure to the low back, and it's a very gentle, safe way to adjust the patients that have spinal stenosis. So we're going to bring it up, and then we're just going to apply a pressure down, and it's going to drop down. And we're going to bring it up again, and we're going to drop down like that. And again, if you're dealing with spinal stenosis, a lot of times the traditional adjustments won't feel very comfortable because one, you may be dealing with some arthritis in that area, and then everything's going to be very tight and rigid. And this, after we do the flexion distraction, is a great way to adjust the low back and take the pressure off. So if you're dealing with spinal stenosis, give my office a call at 703-912-7822 or schedule online at novachirowellness.com.